Good day, everybody. It's a real privilege to be here today. My name is Christa Shedrawi, and I'm here actually on behalf of somebody else, Professor Janetta du Plessis, who had a very sad experience in her life at the moment, and she couldn't be here. So I'm talking on behalf of AUTHeR, and I'm actually saying welcome to everybody. AUTHeR, what is AUTHeR? Should I say or should I not say? Let me quickly say that AUTHeR is actually a research department from social science. And in AUTHeR, we are actually looking at the socially responsive research. How beautiful is that? Socially responsive research and the sustainable community development. And this morning we actually started with the launching of a program which is called the Life Plan. And that has come because of research and because we found a way to make that practical for the community. I'm going to ask you to just enjoy today. This webinar is really special. It's going to be different. It's an alternative way of communicating who we are. Going to have 7 speakers? No, we're going to have 5 speakers and 7 minutes each. So promise it's only going to be 35 minutes. We want to say thank you to the people who are helping us here, and that is Mr. G.P. van Rede van Oudtshoorn en meneer Pieter Moller van die marketing department. Baie dankie.
So there's no chance to even sit down, one has to stand up. I thought I'd share the new letter of the alphabet with you. And if you look there, what do you see? Is it health or is it wealth? Many of you have heard the solution to solving poverty. They have a war against poverty. And I've always wondered, why do you want to have a war against poverty? Surely, if you want to address poverty, you must create wealth. And it's really demeaning, particularly the politicians who define people living in informal settlements as being impoverished. They suffer from poverty. Now, that's purely in material terms. What wealth have those people got? They've got wealth of family. Can be broken family. I don't think any person has a perfect family. What about their spiritual wealth? Cultural wealth? Skills wealth, even though it might not be realized. The wealth of education. And the wealth of the senses that they might have at their disposal. We've got a lot of senses that are we really using. Now, all of us know circumstances are not what they should be. And in South Africa, circumstances are especially what they shouldn't be. What are these circumstances? People are living without sanitation. Their first challenge when they get up in the morning is how do they empty their bladder and their bowels? Imagine waking up, and I'm sure none of us here have that problem, but where are you going to do that in privacy and safely in these informal settlements? What you do with waste management? What you do if there's no water? And people always talk about water and sanitation. I've try and change that to, you must always think of sanitation and water, because if you provide water, sanitation doesn't follow. But if you provide sanitation, waste disposal, water will always follow, and that's the easy one. What about safety of people? What about fire safety? What about safety of shelter? On a day like this, what sort of shelter safety is there if you haven't got enough clothes for your infant, for example? What food security is there? What school safety is there? What employment safety is there? And you've got all of this need when in reality there is actually more than enough resources. There's an abundance of resources to satisfy all of those needs. And another reality is you cannot accept that government is going to solve those problems for you. So for today, with the launch of Life Plan, my journey, your journey, our journey, my talk has got a number of circles or spirals, as you might pick up. Government's not going to solve it for you. No, it's not going to solve it for us, or all of it. They can provide part of it. But the journey starts within oneself. If one's ever going to hopefully realize that wealth, which is health, or health, which is wealth. You can't separate the two. And part of that reality of the wealth of health is that if you haven't got it, suddenly it becomes valuable. If you lose a leg, or if you lose a tooth, or if you lose an ability to do something, your speech or something, no money can sort that out. So the intention of wealth and health being intertwined is to somehow put the reality of the investment in your own personal health into the forefront. And it's funny how we accept it. And I still haven't got the answer as to what is going to make us take that investment seriously. For me, it's taken, I won't say how many years, taken decades to get to the point of where I've realized that nutrition is fundamental to health. It's the biggest exposure to the environment that we've got. And politically, people talk of radical economic transformation. What does that mean? And the best way of realizing that is if one gives that power to an individual level. And we've got relationships with BRICS countries. And my experience of China was that everyone grew food up to their doorsteps. They didn't have these lawns, which can be called hosepipe haws, that just take up every bit of water you've got without anything to eat. They grew food up to their doorstep. And that, as part of you're growing your own money. And not only are you growing your own money by providing nutrients, you know where that food comes from, and you're investing in your own health, and you're doing something creative. And with that small experience, it's a complex interweb of developing oneself, positioning the community. What about urban agriculture as a massive opportunity for growth? At an individual level, it's something that's within everyone's reach. And without all the other needs that are listed in terms of the problems in the communities at all the different levels, to work for yourself, to work as a team. And it's not a teamwork, it's called teaming. It's opportunistically taking who you can, what you can, to get as wealthy by being healthy. Thank you for the 7 minutes.
Good afternoon. Come with me on a short journey back to 1971. I want to start by reading you a poem. It was written by Ruth Johnson. It's going like this. Listen, nurse. I was hungry and could not feed myself. You left my food tray out of reach on my bedside table, and then you went and discussed my nutritional needs at a nutrition conference. I was thirsty and helpless, but you forgot to ask the attendant to fill my water bottle. And later, you charted that I refused to take some fluids. I was lonely and afraid, but you left me alone because I was so cooperative. I never asked for anything. I was in financial difficulties, and in your mind, I became an object of absolute annoyance. I was a nursing problem, and you discussed the theoretical basis of my illness. But you did not see me. I thought to be dying, and thinking I could not hear. You said you hoped that I would not die before it was time to finish your day, because you had an appointment at the beauty salon before your evening date. You seem so well educated, well spoken, and so very neat in your spotless uniform. But when I speak, you seem to listen, but you don't hear me. Help me. Care about what happens to me. I am tired. I am very lonely. And I am very afraid. Just talk to me. Reach out to me. Take my hand. Let what happens to me matter to you. Please, nurse, just listen. So from 1971, a poem written in Philadelphia, in America, to 29 May 2018 in South Africa. And ask yourself, what has changed in healthcare in modern society? You see, it takes me back to a notion of Joyce Travelby that said health and care is a human-to-human relationship. Treatment is to provide medication, to do your surgical intervention to cure. But to truly care is to understand that I, you, we all will suffer illness. We will all die. And somewhere along the line, we all want to have real care. So care is supposed to be something very universal and very human. It requires you to know who you are and to know why you care. And that's why I'm asking the question today. Do you think care can be corruptible, and can care be sold as a commodity? The answer is yes, definitely. Let me take you on a short journey. Let's consider in the private healthcare industry the extreme increase in medical insurance. Think about within a population of approximately 52 million people, less than 16% of us can afford an unaffordable medical insurance. Think about the increase of your out-of-pocket expenses that you had to pay despite a medical scheme. And that we've reached the point that having a medical scheme does not necessarily guarantee you that you will get care. On the other hand, let's consider the past year's events with Life Esedumeni. Let's think about the strikes that we experienced in the Northwest Province the past month. Think about participants in a strike running and consuming all the patients' food. Think about the news events of the corruption of supposedly financial expenditure to go to health facilities. So in South Africa, care can be corruptible. It can be a commodity. As it stands now, healthcare in South Africa is unsustainable. We have a very small amount of people with a medical scheme, and more than 80% of society fully dependent on government-funded healthcare. The only solution for an unsustainable health system is the National Health Insurance, or the NHI. The NHI is an ambitious funding system to bring these two worlds closer together. It's to make healthcare more affordable, more accessible, and to bring quality to healthcare. But what I propose today is that the National Health Insurance, with its ambition to bring two health systems together, is only 50% of the process if we only focus on the external aspects of healthcare. That's why I want to propose today. As our country aims to improve healthcare and health systems through the National Health Insurance, consider this. Why can't we, if we upgrade the infrastructure of a hospital, also have a process running as important to explore the empathy of health professionals and see how can we help health professionals to relocate it true north again in why they care. As we work in primary healthcare clinics to get the waiting queues lower, try to get everybody to have medicine, can't it be a compulsory performance appraisal that in a peer review, colleagues have to be accountable for the interpersonal relationships that they have with patients? If the National Health Insurance aims to train more health professionals, can't it be that 50% of that should be a compulsory self-awareness process that must happen within the trainers and the students? And therefore, I put it to you today that care is universal. It can be corruptible. It can be a commodity. But it can be a process where we change from the inside out. It requires a heart change. It requires to take something as tangible as the National Health Insurance and add to that something as tangible as human-to-human relationships. Thank you.
Okay, good afternoon, everyone. I am a trained quantitative researcher by nature. I can keep you busy the whole day with numbers and statistics, but don't worry, I'll just do it for the next 7 minutes. I can get lyrical about prevalence of disease and incidence of disease and its associated risk factors. I can go on and on about odds ratios. So my journey as a quantitative researcher took me on an unexpected path. I became part of a research team that's part of 27 countries looking at the development of cardiovascular diseases. So, being part of this research team, I was part of data collection. And day after day, year after year, our population will come in and we would do screening. And we would see that our population of interest is very susceptible to hypertension. And I would sit there by myself and I would think, these people come in, for the first time they get screened, they hear they have hypertension. They get screened for a second time, to hear again that they have hypertension. Some of them even for a third time. And I thought to myself, so what? What am I doing? What is my contribution? I keep telling these people, you have hypertension, you have hypertension, you have hypertension. But so what? And it made me think of this health promotion parable. If you can imagine this situation, a passerby walking next to the river, and there's someone floating down the river in the current, about to drown. He jumps in and he hauls him out and performs CPR to save the man's life. But there comes another person floating down the current, and he jumps in and he saves them just to save another person. And so it continues. At one stage, the passerby yells to community members of the nearby village to say, please come help me, we have to save these people. And as they save the people, one of the community members say, why don't we just walk upstream and see why the people are falling into the river? And that is exactly what this parable illustrates. It illustrates the conflict between public health's mandate to protect, to treat and to cure, versus its mandate for prevention. But our core humanity dictates us to treat and to cure. But it hinders us on focusing upstream on what is happening upstream. Why are these people suffering? Why are they getting diseases? And what is the problem about thinking downstream? What is the consequences of operating only downstream? Sometimes we are so far downstream, we're almost out to sea. And if you look at the Ebola outbreak in 2014, 3 countries were critically affected. West Africa. Sierra Leone, the impact of the Ebola virus alone on Sierra Leone, they lost 50% of the private sector. $2.2 billion, which is almost 30 billion, 27 billion rand, that was lost in GDP for those 3 countries. Almost a quarter of Sierra Leone lost their health service staff. It was a decrease in the health services. 881 healthcare providers were infected. 513 died. So, collectively, the UK, the USA, the World Bank, and Germany invested almost 44 billion rand in fighting the Ebola epidemic. So it's the here and the now, the downstream. But according to the CDC, the primary prevention for Ebola is hand washing. Hand washing and washing of food. It's not expensive interventions. So imagine if governments, if World Health Organizations, if Health Authority Organization invested the same amount of money in preventing diseases, in basic fundamental conditions to prevent diseases as they do for treating diseases. Imagine if we could have to be infected with the Ebola. A research study was done just after 2015, where they've done a cost analysis of having the Ebola virus. What it cost, if you survived, it would cost anything between 6,000 rand up to 18,000 rand, which they call the societal costs, which is for direct treatment or your productivity loss. Having either passed away, it would cost between 18 and 275,000 and 230,000 per person. In those three countries, 228,000 people were infected, 11,000 people died. Taking the worst case scenario, that would have cost almost 3.9 billion rand. Imagine taking 3.9 billion rand, investing it in education, providing people with access to access their sustainable resources. Imagine the world we can have. In 1986, the Ottawa Charter for Health Promotion said there's 8 prerequisites for health: peace, shelter, food, education, income, stable ecosystem, sustainable resources, and social justice and equity. We cannot focus only on stream if these are still determinants upstream that needs to be addressed. So as a quantitative researcher, I realized, it's not very clear there, but it says, don't look at the numbers. We have to start looking beyond the numbers. We have to start looking at the person that's behind that incidence or that prevalence of a disease. So I want to challenge you 4 ways. We have to change our assumptions and the way we look at health and poor health. We have to focus on the causes of the cause of diseases. We have to realize that people don't engage in behavior because of choice merely. That's a simple statement to make. People make choices because they are structured by the condition that they live in, by the community that they are part of, by their education. We have to stop focusing on individual lifestyle choices. So, to conclude, watch out for drifts. We start with such good intentions, but we seem to drift. We have to be authentic and we have to take partnerships. We have to have people involved from outside our own circle. And concluding with my topic as a zero is nothing, you might think we don't have billions of rands to invest in infrastructure and millions of rand to invest in education. However, that small contribution that you make, that student that you deliver, that health program that you develop, your industry partners, we all make a difference. It might seem as a zero, but zero is not nothing. Zero has a value. Zero is the middleman between -1 and +1. It is just not nothing. Thank you.
Good afternoon, ladies and gentlemen. Well-being is an elusive concept, and it has been so in modern times. And researchers have grappled with questions such as, what gives people meaning? What is happiness? What constitutes well-being? And can happiness be increased? And new fads and fashions come and go, but what will remain is the centrality of people and well-being. The importance of well-being is stressed in the United Nations Sustainable Development Goals, of which health and well-being rates third of the 17 goals to transform our world. The value of well-being was recently discussed at the World Economic Forum, where it was mentioned that the gross domestic product is a poor measure of health and wealth, which Professor Robinson also alluded to, and that is necessary to bring in new holistic well-being measures in the calculation of GDP. Some of these measures have been developed, such as the Happy Planet Index and the World Happiness Index. But remarkable progress has been made in repairing damage to human beings in the disease model of functioning. But focusing on disorders and focusing on deficits, it's becoming increasingly apparent that this doesn't do justice to the rich potential of human existence. For a long period of time, promoting productive, meaningful lives and nurturing talent were left unattended. The absence of mental health issues is not the same as flourishing. Even if we are free of distress and disorders, this isn't the same as living our life to the full and developing to the peak of our potential. What about the strengths and virtues that make some people so desirable to follow and to emulate? What about those beautiful aspects of life that give us a reason to get up in the morning? What about cherished experiences of love and laughter, hope and happiness? The science of positive psychology seeks to understand and promote these aspects of psychosocial well-being in various life domains and in various contexts. It is dynamic in nature and aims to encourage holistic well-being at interpersonal, intrapersonal, and societal levels. Positive psychology has made remarkable strides in research and practice. At first, it was regarded as a movement, then a new paradigm, later a subdiscipline of psychology, and now it is a distinct scientifically based discipline which is recognized. There are also misconceptions of positive psychology, that we all have to walk around with a smiley face, or that's the Pollyanna way of life, or the power of positive thinking. And contrary to this, positive psychology embraces the negative in life and takes this into context and almost builds a bridge, this image indicates, of functioning well in our approach to life. The research of Leo Bomersky and colleagues addressed the fact, can happiness be increased? And they looked at what determines happiness. And they found that 50% is attributed to hereditary factors, 10% to life circumstances, and a whole 40% to intentional activities. And this is where positive psychology starts in, with intentional positive psychology interventions. Bringing this closer to home and packaging it as positive psychology education. At the Africa Unit for Transdisciplinary Health Research, we offer 2 programs that are the first in South Africa and the first in Africa. There's a master's degree in positive psychology and a PhD in health sciences with positive psychology. Please visit our website to get more details on this. We can all aspire to embrace well-being and to be free of problems. But we can try and truly flourish as human beings and really make the most of our brief lives. Positive psychology helps us aim to do just that through empirical research and theoretical models and through practical positive psychology interventions, such as helping people to find and create more meaning in their lives. Did you know that the primary source of meaning in people's lives is interpersonal relationships and family? And second to this is the work environment. And while positive psychology is by no means a panacea for all ills, if it can add a little light to these challenging times that we live in the diverse context that we live in, which I do believe it can, then surely it should be welcomed in each personal development journey, into my journey, your journey, and our journey, to make a proper and huge impact, a real-life impact on the society of today. Thank you.
Ladies and gentlemen, thank you very much for being here today. I want to challenge you today and ask the question, how sustainable is the concept of sustainability? So who am I to actually talk to you about sustainability? As you can see, I'm not very big, and I've got a kind of a yellowish skin tone, so there's some resemblance to me with the elf. And what we have really in common is that I throw the spanner in the works. So normally I'm the person who asks the difficult questions of the money that you are spending. Is it actually going to achieve what you wanted to achieve? And is what you're doing really sustainable? And in the end, so what? Are we really doing what we want to do? So let's first discuss sustainability. So according to the dictionary, sustainability means that something has to be maintained at a certain level. So in essence, isn't that unsustainable? I mean, even a computer has to be rebooted from time to time, and a robot goes into that type of motion. So yeah, the definition of sustainability in itself is unsustainable. If we talk sustainable development, those concepts are used the whole time interchangeably. Then we all refer to the Brundtland Commission's definition, where they say sustainable development is development that meets the needs of the present without compromising the ability of future generations to meet their own needs. What does that mean, ladies and gentlemen? Seriously, we don't know what their needs are going to be, and things change at such a pace that we cannot keep up with it. So currently, sustainability is measured on 3 levels. So because of corruption, there became a need for companies to actually not only say what they do on a yearly basis in terms of their economic activities, they also have to say what impact they have on the natural environment and what impact they have on the social environment. Why? Why did we have to do this? Because we are all selfish people who only want to meet our own needs. but then we live with a definition where we say we want to be able to meet the needs of the future generations. I want to challenge you to think about that. So the King Code requires all companies to report on the triple bottom line. And as you can see, sustainability is an interconnected concept. So what is my issue? What is my issue with sustainability? My issue with sustainability is that people use it to justify their own needs and wants, and they use it just to get what they want out of the situation. They don't even understand what it means. They use it to sell ideas. They use it to get funding, and they use it to market their products. We all have seen big food groups, delivery trucks going past with some claim to sustainability. My question is it really true? Is it really happening? So that's my issue with sustainability, why I say it's actually unsustainable currently. So how do we measure sustainability? There's only one way to measure sustainability, and that's over time. There's no once-off measurement for sustainability. So if you've ever encountered a consultant that wants to tell you that he can measure the impact of your intervention in a once-off, I'm sorry, that guy took you for a ride. So please re-evaluate. What are we measuring? How are we measuring it? And what is going to be the impact of your intervention? So now, how do we make sustainability sustainable? I would like to ask each of you to stop looking at the big picture view of sustainability on a mega level and bring it internal. Start saying in your life, how can I change my daily living to make it more sustainable? So let's move from an external view to an internal view. Big picture, we have to look at big picture, but small picture as well. Then let's start with our journey. I can stop using straws. I can start planting a vegetable garden. I can start reusing my water, my grey water. Each one of us can make a contribution to living more sustainably. And then let's share. Let's make my journey your journey. I can go with you on your journey. And then let's make it our journey. Then let's start living authentically. Let's start declaring our motives so that we're transparent and we can help one another to also be sustainable. Wholehearted living is in the core of all of this. I want to challenge you to do that. So let's nurture, love, and respect ourselves, each other, and our community. So my proposition is, let's reclaim sustainability through a new triple bottom line. Let's start using our heads. Let's reflect every day on our practices and what we do. Then let's use our hands and start really doing it. Let's go into deep engagement with what we do on a daily basis. And then with our hearts, let's start living in relation with each other, with our environment. And then we will get back to wholehearted living. So let's move from viewing the environment as a commodity to viewing the environment as a community. Let's stop having a consumerism view to being a conserver. Let's stop being a short-term reactor and start becoming a long-term evaluator. So then I just have a last challenge for you. I want to ask you, would you dare to question who you really are? Thank you, ladies and gentlemen.